Hi, everyone. It is National Infertility Awareness Week. And to celebrate bringing awareness to a topic that can feel so lonely, we are talking to some amazing guests this week. On today's episode, I had the pleasure of speaking with Dr. Ravi Gada. Dr. Gada is a board certified reproductive endocrinologist at Dallas Fort Worth Fertility Associates. He did his residency and fellowship at the Mayo Clinic, and it was there that he fell in love with the puzzle and pace that is the world of infertility. In this episode, we talk about Dr. Gada's personal journey with IVF, the advancements that reproductive endocrinology has made in just a short time, and where Dr. Gada thinks that they are heading, bust a few myths, and we get to hear a little bit about Dr. Gada's closeness to stardom when he got to be on a reality show. This was a super fun and informative chat, and I hope you enjoy listening as much as I did. Me, you, and who? Who knew it would take more than two people to have a baby? In a world where infertility is no longer a taboo topic, this podcast will take you through all the different aspects of surrogacy and egg donation through the lens of many who walk this journey in different ways. My name is Whitney Hall, and I am a two-time surrogate, now turned surrogacy coordinator for Egg Donor and Surrogate Solutions, the very agency I used when I chose to carry for two amazing families. With this podcast, it is our goal to help guide and support you as you learn about what it takes to grow a family in an alternative way, as well as hear inspiring and beautiful stories of how this path has changed lives forever. We can't wait for you to hear about just one more way happy families are created every day. Hi, Dr. Gada. Thank you so much for taking the time to meet with us.
Hey, how are you?
Oh, doing fantastic. Doing fantastic. It's a beautiful sunny day, a little hot in Houston, but we're making it.
Yeah. Well, thanks for having us, inviting us onto the show.
Yeah, absolutely. Absolutely. Okay, so just to start off, what even got you down the path when, ultimately your path to medicine and then ending with the career of reproductive endocrinologist? How do we get there?
Yeah, so I guess I would say my path started when I was a child. I grew up, both my parents are physicians, and so
Mhm.
I grew up in a house full of physicians. They were very encouraging to me and my siblings to go into medicine,
Mhm.
and in fact, we all did. So I have two older sisters. So all five people in our family are physicians, and
Oh
so
my gosh. I'm
yeah,
sure that
yeah.
makes dinner table conversation hilarious.
Yeah, exactly. Yeah, depending on who's there with us, exactly.
There you go.
So ultimately, ended up going to undergrad, doing a biochemistry degree, and then
Mhm.
and then subsequently med school, and really just had an affinity to OBGYN residency. I
Mhm.
got along with the residents that I was training under as a med student. And ultimately, I would say to their credit, they really had a lot to do with convincing me to do OBGYN. And
Mm.
I thought I was actually going to go into OBGYN and do a fellowship in oncology, GYN oncology, like ovarian
Sure.
cancer.
Yeah.
And actually that led me to doing my residency at Mayo Clinic, which is a big oncology program in
Yeah.
Minnesota. And somewhere along the way during my residency training is when I got introduced to reproductive endocrinology and IVF and reproductive surgery, and ended up really just falling in love with that as a specialty. And so it wasn't until about maybe my second or third year of residency that I ended up changing my mind from oncology over to fertility. And then I was lucky, got to stay at Mayo to do my fellowship, and then
Yeah.
ultimately ended up back in Dallas.
Oh my gosh. Wow. So we went like just all over the place. First we're doing this and then this. Wow, that's awesome. That's fantastic. So what was maybe the thing that drew you into reproductive endocrinology versus sticking with oncology?
Yeah. So some of it was the research that I was doing, and
Mm.
I think that I mean, a lot of medicine is on cutting edge of technology, but
Sure.
the way I looked at it back then, and I still look at it today, is that nothing is changing as fast as reproductive endocrine, at least in my opinion.
Mm.
And so oncology is very neat. I very much enjoyed the surgery side of things. I still do a fair amount of reproductive surgery even today, as like fibroids and endometriosis. But um, ultimately, the surgery skills are the same. It's challenging, but the
Mhm.
surgical technique changes a little bit. But nothing is advancing as fast as IVF. I mean, IVF, even from when I started my fellowship, finished it in the 10, 12 years I've been in practice now. I mean, every year there's advancements that are happening
Yeah.
that are significant and really much more innovative and just ever changing and keeping us on our toes as reproductive endocrinologists.
Mhm.
And I think that those are the parts of it that really interested me, is just the amount of change that would happen over my career versus just feeling like, a lot of it was just similar work, year over year.
Sure, sure. Yeah. I mean, and it is. I mean, in the short time that I've been in the world of infertility, certainly not 12 years just yet, but yeah, I feel like in the seat that I'm sitting, it is just going so fast in how people do things. I mean, you know, once upon a time where when it comes to, surrogacy, right? Like we're doing multiple eggs and all kinds of things. And now it's like, nope, just one and, just things like that. So, yeah, definitely. So, what would you say maybe excites you when you're coming into work every day?
Yeah, yeah. Well, and to touch back on just what you were saying about how much things
Yeah.
are changing, for people that are listening, the history of IVF is kind of a interesting thing. The first IVF baby was born in 1978. So I'm 45. She's born in 78, and she was too. I mean, to just think that our field is only this old is really quite amazing. So I mean, just a fun fact is the oldest IVF baby is
Yeah.
45 years old today, or this year turned 45, and
Which,
then our
like,
field is just that new.
yeah, like by comparison, if you with IVF being 45 years old, what would you compare that to as opposed to like, I don't know, oncology or something
Yeah, I
like
mean, oncology, I mean, I think surgeons and physicians have been dealing with that kind of stuff since like the 20s and 30s. I mean, surgeries have been done for quite some time.
Yeah.
Drugs have been around for a long time, all the way to apothecaries back in the 1900s. But
Sure.
I don't know that outside of maybe some stem cell regenerative medicine, I don't know of anything that is brand new in the last 30, 40 years
Yeah.
as a field.
Yeah. No, oh yeah, and that's just yeah, that's great to just have that comparison of like it really is just new. And yet, like you said, so much advancement is happening so quickly. Okay, so
Yeah,
what excites you to go into work every day? What makes you just be like, "Oh yeah, I'm ready to go. Coffee down, let's go."
yeah, I mean, that it'll sound a little bit cliche, but we see a lot of patients. We're a big practice, and obviously we come to work every day to take care of patients first and foremost. But
Yeah.
the people that we work with at our practice are really amazing. My physician colleagues, the nurses, the embryologists, the
Mm,
sonographers, the front desk, phlebotomy people. I mean, we hang out with each other more than we hang
yeah.
out with our families sometimes at home, because we're here for 8, 9 hours every day, and you're
Mhm.
only so many hours left for the rest of that day to hang out with
Sure.
your family. So we have a great team, and I would say working with them every day is a pleasure, and helps every day get through the day, and then obviously the patients that we take care of, and everybody's story is just a little bit different. IVF
Mhm.
can sometimes feel the same, but the reality is each patient has a unique story and a unique set
Mhm.
of set of circumstances and a unique outcome that keeps it very interesting.
Yeah, for sure, for sure. So speaking of stories, you have a personal journey with IVF.
I do, and a lot of people do, right? I mean, we know that fertility
Yeah.
touches, now 1 in 8 couples, and my wife and I did fall into that category.
Mhm.
And she doesn't mind me disclosing this, because we did a little TV episode about it, and we've done some different things in the past,
Yeah.
because it is interesting to have a fertility physician who's also undergone IVF, but
Mhm.
we had PCOS. My wife had PCOS, and for some of the people that know about PCOS and know about AMH levels and other things, her AMH
Hmm.
level was 31, which is
And
pretty
what's
high.
considered normal?
Yeah, normal's like 1 to 5, and at the time when we ran her AMH, it was one of the highest AMHs I had seen. I had to go to ask my partners. I mean, I don't know that I've seen a higher one than that, and so.
Yeah.
But we tried Clomid, we tried Letrozole, we tried some of your basic stuff first, and
Sure.
to no avail. So we did do IVF, and we ended up with quite a few 42 eggs.
Oh, wow.
Yeah, and this was right around the time when we didn't have Lupron triggers were not like mainstream. I mean, it's
Hmm.
obviously very mainstream today. So she had an HCG trigger, which is, again, was pretty routine back then, still is pretty routine now. So she did develop ovarian hyperstimulation syndrome
Oh, gosh.
afterwards,
Yeah.
but nothing that we had to drain or do anything too much other than just get through it. So we had to freeze our embryos, which is standard now, but back then it was still kind of right
New.
on the cusp of fresh versus frozen embryos. And
Sure.
but ultimately, in all of that journey, we have a 6-year-old and an 8-year-old from that egg retrieval, and so it was a like everybody else that goes through this, an interesting journey with some uncertainty, and it all
Sure.
worked out. So
Yeah. What was that like navigating that in the seat that you sit as, you're a doctor, you know all of the things, and then all of a sudden I mean, for lack of a better word, I mean, you and your wife are now the patients, right?
yeah, yep. So doctors. I mean, doctors and nurses are always a patient in some capacity, whether it's
Sure.
just our screening lab tests that we go and see our regular doctor for, a surgery, but you know, not very often are you your own patient in a subspecialty like reproductive endocrine or orthopedics, for example.
Yeah.
And so, yeah, it was interesting. My wife actually wanted me to go ahead and manage and do all of her procedures.
Oh, wow.
Yeah, but I mean, maybe it's just a comfort level type of thing, but at the same time, one, there's some rules around whether or not you can treat your own family members and some things there. There's a gray zone area, but also the whole side of just what if something doesn't go that well, or am I there to be the husband or the physician? So ultimately, I did
Sure.
have my partners run everything. There I trust every one of them. With my family members, and so
Yeah.
so I was really more on the patient side of that journey with her, although trying to uh, manage that role. But she would all the time tell me, how I don't know how a fertility patient does this without having their own fertility doctor at home to ask questions about every little thing, because there's so many
Sure.
details, and of course you try your best to explain everything in the clinic, but inevitably random questions come up which lead
Absolutely.
patients to either feel like calling and hopefully getting answered, but a lot of times it leads them to the internet or other places, which uh, doesn't always get you the best answer.
I always say beware of Dr. Google and Dr. Facebook.
Right. So
Yeah. So I mean, going from, being the patient, and then now obviously continuing to be a treating RE, how did just you change as a doctor having that now personal experience?
yeah, it definitely gives you a unique perspective. At the
Yeah.
same time, I would say, to all of the other reproductive endocrinologists that either have gone through fertility treatments or not, I still think they're very empathetic to their patients, and
Oh yeah.
and 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 so we deal with this so much that but it does help a little bit in that when patients know that even a reproductive endocrinologist who knows everything about IVF and how to help people get pregnant still needed to have to do IVF themselves. I think to a certain degree they feel a little bit less like, well, it's not just our fault. Like it's not something we're doing. It's not this. These are people that know
Yeah.
everything about it, and so I think more so I share that story with patients and out there because. And by the way, 1 out of every 8 statistically fertility doctors have gone through fertility treatment. So I've had friends that have gone through it with
Mhm.
us or at their own practices or called with advice. And so plenty of us have been there, done that. But I think the most important thing is this notion that even fertility doctors who know everything about it still ended up, you know, needing to use assisted reproductive technologies. And but also what I found is quite interesting is patients feel a little bit of comfort in the safety of IVF in terms of
Mm.
outcomes for their spouse or their children when they know, well, oh, well, if you were willing to do it for your kids, it must be pretty safe. And we try to relay that it's very safe, but I think that's helped the most. And so it is great. It is definitely when you're on the patient side, it gives you a perspective. But I would say, it does change you a little bit in your perspective, but even
Mm.
all doctors that are fertility doctors are just it's a very unique specialty and so good at what they do and empathetic to their patients and I
Mhm.
think really have a way of putting themselves in their patient's shoes, whether they've been there or not, but they understand it.
Absolutely, absolutely. Yeah. So it was interesting you said, 1 in 8 individuals who are trying to have a family are going to need some form of assistance when it comes to, fertility. And yet it still feels, when I'm talking to anybody, one of the biggest things they always say is I felt so alone through the process, or I didn't necessarily know anybody that was going through it. And so, there's this big push, National Infertility Awareness Week, there's this big push to try and make this less taboo and have people talk about it. So what would you say, being in it for, as long as you have, what changes have you seen with just the awareness factor?
Yeah, I mean, there's big changes. That's another side of it. Even when the science isn't changing, just the evolution of how people talk about fertility has changed over the
Yeah.
last 2 decades. So I think first and foremost, it is certainly, in my opinion, not taboo anymore. I do think 20 years ago it might have had a little bit of taboo behind it that we had to do fertility treatments. I
Mhm.
hope that people don't carry that feeling anymore, and I hope certainly no one feels that way about couples who need to do fertility treatments.
Mhm.
But I think that lots of celebrities have engaged in the reproductive medicine, talking about their own journeys, whether it's a miscarriage, whether it's IVF or egg freezing,
Mhm.
which has really shed light on the subject. Social media has really helped in terms of support groups um, and talking about it, and maybe not, this comfort level of talking about your own medical care. I have to go have this procedure done
Mhm.
is kind of hard. And if you have someone really close in your life, friends that you can talk to, great, but they might not be able to relate. But behind a social media platform maybe gives you just enough comfort that you can ask a question to someone and talk
Yeah.
about it, but not feel like you're disclosing your personal medical care. And so social media, I think, has been great. Obviously, we all know it has its downsides too, because
Sure, double-edged sword.
of course, I mean, I'm every day having to talk to somebody who was referred to our practice or just active in the social media that hears a story about a test or a way of doing fertility that maybe
Mhm.
they want to try, but as soon as you talk to them about why it might have worked for one person versus the other. But that outlet has been great. I think it's amazing how many moms groups that are out there in terms of social media or even just in the community. If someone wants to see a fertility doctor and asks, any recommendations, in the past, nobody would have a problem recommending a dentist or a pediatrician to their friend.
Sure.
A lot of people would have a hard time saying, "Oh, well, I saw this fertility doctor or that," and now when someone asks, usually on a mom's group or social media, I mean, everybody is commenting, "I saw so and so, they're great. I, got pregnant doing this or that," and I
Mhm.
don't think
Mhm.
people wanted to talk about that as much in the past, but I think now, and especially after you have a child, it's a lot easier to talk about it, right? I think while you're
Yeah.
going through the process, people still are a little bit reserved because the uncertainty of whether it's going to work or not.
Yeah.
And nobody, I shouldn't say nobody, but a lot of people are concerned about talking about going through fertility treatments, knowing it may not work. Whereas,
Mhm.
if after the fact and you have a child in hand, and now you feel very much like
You
that
know how the
pressure's off.
story ends.
And yep, know how the story ends. And I think at that point is when you really become an advocate for other people to go out and seek care, because you see the fruits of that labor, and you want others to be able to achieve the same goals. So
Yeah, yeah, absolutely. So it's interesting you talked about, the social media, and you're, every day talking to somebody about, well, there's this and there's that. What would you say is maybe one myth that you would want to bust when it comes to that lovely double-edged sword that is social media?
oh boy, oh, there's so many, but I don't want to get I don't want to get anybody in trouble who's either practicing this way or some groups. But there are a lot, right? I think that um, just something as easy as endometrial receptivity assay, endometrial function test, Emma Alice, um, BCL6, right? These are the group
Woo!
of
You threw some big
I,
words at me.
I know, I know. Yeah, I'll explain it. I'll explain. But these are, I would say, in aggregate, these are the group of tests that have to do with the endometrial lining specifically. And if you've had failed cycles and we're putting embryos back, I mean, the first thing a patient asks is, well, what else is there left to do workup wise? And
Okay.
should we be doing anything additional testing? Because I put back 1, 2, 3 embryos, it's not working. And the sense of, well, if we just recommend, well, we just need to keep trying and hang in there. That's a hard thing to do when you feel like, well, we're doing the same thing over and over again. So let's test something. So these tests, I don't know, they have some value. Some people feel like it may not. ERA was thought to be really helpful in defining the progesterone window. I'll leave it at there's much debate whether that test has value anymore, but there's still plenty of physicians that recommend it and believe
Yeah.
in it. Plenty of patients who did a test and changed that window and then got pregnant. So
Mm-hmm.
it's a very believable story, and there are a lot of people that still believe it today. But there are studies and papers coming out, questioning whether or not that is as accurate as we think, and could it even a study that says it could be harmful, and that changing that progesterone window could have possibly lowered pregnancy rates. So it's not so much a myth versus, I would just leave it as a controversy of, are
Sure.
these tests
Sure.
really helping anybody or not? I would tell you my opinion is probably not yet. Maybe one day we will get there. And then the other one is all the home testing that people are doing, which is
Mm.
very interesting. And I think home testing is an amazing part of where the field of medicine is going to go. I am
Home
for certain
testing
that,
as far as ovulation, or
yeah. So ovulation, I think, is down to a science.
okay.
Pee on the ovulation predictor kits, see your ovulation, perfect, right? I think it's more like the AMH at home, semen analysis home kit. Put a sample in a cup
Mm.
and FedEx ship this to some place, overnight. Have them read it. Whereas, when we do a semen analysis, we tell our patients we need to have that sample in our office within 45 minutes to an hour to get an accurate sample.
Wow.
And I don't think you'll find a single fertility clinic in the country that recommends less than, more, uh, any window outside of that. But
Yeah.
there's kits where you can actually give a sample and put it on a chip and plug it into your iPhone and see the sperm swimming on your
Oh
iPhone
my God.
and try to quantify it. So it's really quite fascinating. A lot is going to happen in the next decade for home testing. That's what I meant by home testing.
Mm-hmm,
But what's
mm-hmm.
interesting is a lot of the home testing that we have may not be quite prime time today, but it is getting there, and it is light years ahead of where it was 10 years ago. But
Yeah.
I predict that over the course of 10 years, and 10 is for medicine is not a long period of time.
Yeah, you're exactly right.
For us, waiting for it to get here is a long time, but for medicine, 10 years is not that long. I think in 10 years, patients might be able to do their IVF ultrasounds and follicle tracking at home with
Wow.
a home ultrasound probe where they insert it themselves, like you would place a tampon, and potentially have to maneuver the wand, the ultrasound wand a little bit, and then it captures all that data uploads it, and then reassimilates it into follicle measurements. People are
Oh,
actively working on
wow.
this today. And then I think you could pee on a stick or a finger prick and get a blood test, and actually all the IVF monitoring could be done at home. That's actually a lot of doctors and scientists and technologists are working on actively on this today. And I think all of us are looking forward to a day where, patients can do that at home and go to work and not feel like I got to go to the clinic and block off 2, 3, 4 hours of my day every other day coming in for IVF, and just making it easier
Mhm.
for patients.
Yeah, yeah. Oh my gosh, that's so fascinating. But right now, we're not quite there yet. So maybe don't hang your hat on some of those home tests.
Not today, but they are coming, but not today. Yeah.
But not today, but not today. That's awesome. What advice do you think you would give that you would want to give to just potential parents, intended parents who are just trying to figure out where to start? Because, again, you plug in the word infertility in Google, right? And now all these home tests are coming up and all these groups are coming up and all of these, I mean, you just get inundated with information, which once upon a time there was no information and now we have a lot, which is so great. But it's so hard to shuffle through it. What advice would you want to give to those intended parents?
I mean, I think the hardest part is just the transition to, do I want to do donor eggs or not? I mean, that in
Mhm.
itself is quite complicated. And I think, it's obviously majority of people probably, if you ask, but I would say a vast majority of people would love to use their own egg or their own sperm when trying to get pregnant. But
Sure.
at some point that that conversation shifts from, should I use my own eggs, to donor eggs, to, if it's not working, using their own eggs. Do we want to have kids through, you know, and carry a pregnancy and go through that process, meaning using donor eggs, or do we not want to have kids at all or move towards an adoption process? I mean, I think
Mhm.
anytime you're faced with, should I use my own eggs or donor eggs? Most people are going to say, well, yeah, of course I want to use my own eggs. And so I always try to tell patients, at some point we might reach a point where if we try after a few tries and we're not getting there, the conversation is not, do I want to use my own eggs or donor eggs? We know the answer to that question for most people. It is, do we want to have a pregnancy and carry a pregnancy and use this alternative solution, meaning donor eggs,
Mhm.
or
Mhm.
not have kids, or go through adoption? So I think that first decision is really hard, for people, and lots of conversations should be had between the partners involved, between, the intended parents involved, plus their physicians to help with that. But once they get
Mhm.
past that, and there's resources for that and conversations, but then it's, where do you start, right? You start
Yeah.
looking at, um, you know, databases of egg donors. And I think
Yeah.
my patients ask me sometimes, well, what does that look like? And I'm like, I mean, it really looks like a match.com type of thing. You get pictures, hair color, eye color, ethnic background, um, basic information, even education level. I
Yeah.
mean, there's really a quite a big profile there. And I tell them right off the bat, or I try to remember to tell everybody, you don't have to, but a majority of people choose a donor based on their appearance, of how they look, and they try their best to maybe resemble somebody that they feel like might look like them a little bit.
Yeah.
And I try to reassure them that that's not a bad thing, because I think people sometimes think it's weird to choose a donor, like to try to choose someone who they feel like resembles them, and maybe like that's a very superficial way of choosing a donor. But I think it's
Mm.
just a practical matter of fact, and certainly you don't have to do that. But I think even just getting it out there to people that are, whether it's they're listening to the podcast here or just in our clinic, to alleviate that concern or burden, like, is it superficial for me to want to have a donor that I feel like resembles me? And I tell them
Yeah.
it is not at all. And in fact,
Mhm.
I would venture to say a majority of intended parents choose their donors that way.
Absolutely. Absolutely. Yeah, for sure. For sure. So you had mentioned, obviously, you love your colleagues, you love everyone you work with. What makes Dallas Fort Worth Fertility Associates, like, what sets you guys apart from other clinics?
Well, I think, It starts with the physicians. We have quite a few physicians in our group now. The practice has actually grown quite a bit since I
Mm-hmm.
started. But I was the fourth doctor to join the practice. We're up to 7 to 8 doctors now, and
Oh,
we have
wow.
locations. Yeah, it's pretty exciting, and we have locations throughout the DFW Metroplex,
Mm-hmm.
and which helps just from a convenience standpoint. I mean, I certainly don't think patients should try to pick the doctor that's the closest to them. I mean, but to be honest, with all the appointments and everything that's involved, the commute matters, right?
Yeah,
So,
sure.
um, but I think that there are great doctors, and then you just look through the rest of the staff. There are a lot of people that care. We're a big team now of embryologists, nurses. Like I said earlier, I mean, these are the reasons why I enjoy coming to work. And I mean, I spend a
Yeah.
lot of time with my coworkers. But
Absolutely. Yes.
yeah, yeah, and so but when you live in a big city like Dallas, there's lots of there are great practices out there, and a lot of them are very good. I think the individual doctors that you feel comfortable with. Some people want to see a female doctor,
Mm-hmm.
I'm this is coming from a male physician, so I
Sure.
get it. And we have some good female doctors, and some people sometimes ethnically want to see an Indian doctor just because they feel like they can relate. And I think whatever makes them comfortable is the most
Mm-hmm.
important thing. And I think um, you're sharing a lot of your personal life and story, and honestly a lot of tears and happiness, and
Yeah.
it's hard to do that without someone that you feel like you can relate to a little bit and can talk to. And so um, I think in a group like ours, there's going to be somebody for everyone. Whether it's
Mm.
me, whether it's Dr. Thomas, Dr. Chantillis, Dr. Lee, Dr. Laura. I mean, we have so many good doctors in our practice,
Yeah.
and I think that and our nurses are an extension of our practice. They interface with the patients a lot, and that's how all fertility practices
Mm-hmm.
are. And the nurses are
Mm-hmm.
just integral to the care that's delivered. And so I think that helps, and just having a big group that's very diverse, lots of different
Mm-hmm.
personalities. Fortunately, in all the personalities and all that, the science is very good. We
Yeah.
all sit in our meetings. We talk about what's the science, what's the medicine.
Mm-hmm.
Lab is top notch. You just and you want to get together on frequently and put all these different personalities together, but to talk about what's best practices for the patients that are out
Mm-hmm.
there, and we
Mm-hmm.
also do that very regularly. So
Yeah, absolutely. Oh, I love that. I love that. Okay. So, well, it's funny. I should have brought this up earlier because you had mentioned how you were saying, celebrities have brought light to to everything, and I loved that you shared your fun little fact about how you got to be on a reality show for a quick second. And I have to say, my husband and I watched your clip, and he said you did a really great job of navigating Terry Bradshaw. So good for you, just by the by.
yeah, 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 it was fun. But yeah, it's interesting. A lot of people ask me, "Well, how did that come about, or did you get a lot of patients from it?"
Yeah.
And certainly there was a little bit of that fanfare. But what was most interesting about that is, I mean, how often is someone get a chance to be on a reality TV show and have
Absolutely.
uh, cameras in the office? I mean, there was a little bit of chaos, in all of that.
I'm
Terry
sure.
Bradshaw, his family, Rachel, who was here. I mean, unbelievably nice people. Very interesting story. Interestingly, she is pregnant now, and she shared that with
Oh,
on social media. And for her and her husband, what an amazing thing. And they were able to get pregnant on their own, as best we know. And
yeah.
so but they he was hilarious. He asked to go see the collection room. I don't know if you saw the clip
I
where he
saw
goes to
that.
ask.
It was hilarious. Yeah, my husband was like, he did good. He kept it together. I was like, yeah, he sure did.
Yeah. And so just to even get to do something like that, because probably all once in a lifetime type of opportunity. And
Absolutely.
so yeah, it was pretty fun. It was pretty fun.
Oh
My
my
kids,
gosh.
most importantly, my kids think I'm famous now because they'll see that on the we showed it to them, and so that's pretty funny. They think their dad's famous because he was on that, and every now and then we're in the magazines that they have around town,
Oh,
in
sure,
terms
sure,
of some of
sure.
these things, and they but as they get older, they'll find out their dad's probably just a boring old man, I guess.
Oh my gosh. I love it. Hey, just hold on to that stardom in their eyes for a little bit longer, right?
Exactly. Exactly. For as long as I can.
There you go. There you go. Oh my gosh, I love it. Okay, so my last question for you, and I've made so many references to coffee. For anyone who knows me, I have a very codependent relationship when it does come to coffee. But I always love to ask, what filled your cup this morning? Literally or figuratively, what filled your cup?
Yeah. So I did listen to some of your podcasts and heard you
Oh
ask that
yeah.
question. So at least I knew.
You
At
did
least
research.
I knew it was. I knew it was coming, or at least I assumed it was. Well, literally, I've kind of gotten into grinding coffee beans. And
Ooh, fancy man.
yeah, yeah.
Yeah.
And not like an espresso, but just a regular. It's like a Keurig. I mean, it grounds a
Yeah.
single serve into a Keurig, a reusable Keurig coffee grounds, and Texas pecan is one of my favorite flavors.
Mm.
There are a few. I have no relationship to the coffee brand Alamo. There's no a hidden agenda, but that is actually what for
But
whoever
that's what
makes it.
calls to you.
It is worth enough for me to mention like that. That is one of my favorite coffees to brew, and
There
so
you go.
and it's fun to kind of grind that coffee beans in the morning and do that. So I drink my coffee with a little bit of cream and sugar. So
Nice.
so
You have a whole ritual.
yes, literally that is what filled my cup in the morning. But I woke up early this morning to go do an egg retrieval on a
Yeah.
patient, and it's always exciting. Like I said, every patient is different. Every IVF cycle is different. It was again, a Lupron trigger, which is a little bit different than a standard HCG trigger, but her LH level, which is a level that we sometimes measure to make sure we got a good enough response, and we checked
Mm-hmm.
that the day before. So that
Mm-hmm.
was yesterday. Was actually low. It was about 7, and we really like for that
Mm.
number to be 15 to 20 to really feel like they got a good trigger for people that have done IVF. Um,
Yeah.
and I had no idea going in this morning, would we get eggs from this patient? Would we get a lot of eggs, or would
Mm.
we find out that it didn't work that well? And this morning I was anxious to get going on that and get started. And then anyone that's wondering, she did great. 24
Yeah.
eggs, did amazing. And but it's interesting, 12, 15, 17 years into practicing reproductive endocrinology, and you're walking into a retrieval wondering, gosh, is this trigger going to work or not? That's still the
Yeah.
mystery of fertility, and the answers we don't have answers to everything. So
Mm-hmm. Absolutely. Absolutely.
yeah.
Oh, well, I'm so glad it was successful. I'm sure that gave you just the wind in your sails for the rest of the day, along with that Texas pecan.
So what filled your literally what filled your cup in the morning? I'm curious what
Oh,
kind of
good
coffee you drink.
question. Good question. You're the first person to ask. So I use this I use a Keurig, and I use a reusable cup because I can't stomach the constantly throwing away the little K cups. So I also use
Sure.
a reusable. I do not take the time to grind my own coffee beans. I'm very much I need to get this as fast as possible. So that's where I'm at in the morning. And I go with a Seattle's Best medium roast, but it's always the fair trade. So that's always my thing whenever I'm looking for coffee. And I'm like, is it fair trade? So yes, that's what I go with. And then I put a little bit of creamer, although this morning it was coconut milk, because I had some leftover from cooking the other night. So I did that. So yeah. You're
All
the
right.
first
Now I
person
know
to ask.
Oh, yeah, I know. I hear you ask a lot of people, and I was like, I don't know what she drinks for coffee, so I'm going to ask her.
I love it. I love it. Well, Dr. Gada, I appreciate you taking the time. It was an early morning, and I know you want to get to your family, and so I really just appreciate you taking the time to meet with us and to, just get to talk about your passion, be a voice to all of our listeners out there who want this type of information. So thank you, thank you, thank you so much. And thank you to Dallas Fort Worth Fertility Associates, who we get to work with on the, egg donor and surrogacy front. And we just love working with y'all. So I super appreciate you taking the time.
Yeah, and likewise, we love working with you guys, and thanks for inviting us, and hopefully good luck with the show, and let us know if you ever
Yeah.
need anything.
Thanks. Thank you so much for joining us on this episode of the Me, You, and Who podcast. We appreciate your time and hope you enjoyed our discussion today. As we wrap, we would like to remind you of some of the ways to stay connected with us and be part of the Me, You, and Who podcast community. Firstly, if you haven't already, make sure to subscribe to our podcast on your favorite platform. Hit that subscribe button so you never miss an episode and can stay up to date with our latest content. But that's not all. We also have an exciting YouTube channel where we share some bonus content, behind the scenes glimpses, and video versions of our episodes. Head over to your YouTube channel and hit the subscribe button there as well. And don't forget to click the notification bell so you'll be the first to know when the new episodes go live. For more exclusive updates, engaging discussions, and a chance to connect with fellow listeners, be sure to follow us on our social media accounts. You can find us on Instagram, Facebook, and TikTok at Egg Donor and at Surrogate Solutions. As a friendly reminder, the podcast is made possible by Egg Donor and Surrogate Solutions. If you're interested in creating a happy family, visit www.createahappyfamily.com to learn more information. Again, thank you for being part of the Me, You, and Who community. Your support means the world to us. Until next time, stay curious, stay engaged, and join us next time as we share journeys of creating happy families.